Neonatal Nurses. On September 15th each year, National Neonatal Nurses Day recognizes those who care for the most fragile patients as they take their first breaths. The celebration takes place in the middle of National Neonatal Intensive Care Awareness Month. Neonatal nurse specialists work with newborn infants who are delicate at birth due to a variety of reasons. They may have been born premature or born with birth defects, infections, surgical issues, or heart problems. Neonatal nurses also provide care for healthy newborn infants immediately following their birth. We produce 5 amazing videos per week, so please click on the like button and subscribe to see future videos. Like, comment, share, subscribe. The demand for neonatal nurses continues to rise. Their expertise and training meet the needs of the youngest, most fragile, and critical patients in any hospital. While most neonatal newborns spend a month or two in the hospital, some require longer care. The neonatal nurse provides their care for the duration of their stay. Some neonatal nurses provide care beyond the neonatal period. The first NICU appeared at amusement parks. In 1901, Dr. Martin Coney introduced the first incubator at the World's Fair in Omaha, Nebraska. From there, incubator baby side shows, entire rows of incubators staffed by physicians and nurses, toured various world fairs until 1943, and it became the longest running show at Coney Island. Fortunately, preemie babies are no longer treated this way. You couldn't always see through the first incubators. Before the 1940s, incubators weren't clear, which made seeing and treating the babies inside a challenge. Once transparent plastic walls were introduced, nurses and doctors stared at the naked babies as if they were seeing them for the first time. According to historical documents, and results improved immensely. NICUs had a powerful advocate, JFK. In 1963, President John F. Kennedy's newborn son, born premature at 37 weeks, died due to immature lungs. This tragedy sparked awareness about premature infants and led to NICU units being established across the country. NICU survival rates have come a long way. Nearly 1 in 10 babies are born premature, and 30 years ago, less than 25% of preemies survived. Now, almost 90% of preemies survive, including infants born as early as 24 weeks. NICUs can save really small babies. The smallest baby ever to survive and be discharged from NICU is Rumaisa Rahman, a twin who was born in 2004 at 26 weeks, weighing just 9.2 ounces. Both she and her twin sister Madeline suffered no chronic health problems, giving hope to parents of preemies everywhere. NICU isn't cheap. A stay at the Ritz or Four Seasons has nothing on NICU, where the cost to care for one infant often exceeds $3,500 per day. Prolonged stays can easily add up to $1 million. Most preemies stay in the NICU until their due date. So that means if your baby was born 6 weeks early, he or she will likely stay in NICU for 6 weeks to help them catch up developmentally to full-term infants. NICU won't stop you from bonding. Sure, bonding with your baby would be easier if you were hanging out at home, but the time you spend in NICU does make a difference. In one study, the more parents talked with their infants at NICU, the better their language skills at 7 and 18 months down the road. Some NICUs are noisy. Between the beeping of monitors, ringing phones, and never-ending streams of family members cooing over incubators, NICUs can be noisy places. In fact, one study found that the average sound levels in NICUs range from 54 to 61 decibels. That's above the 50 decibel levels recommended by the American Academy of Pediatrics. Moms and dads can help out at NICU too. Think only doctors and nurses can nurture the health of a fragile NICU baby? On the contrary, a handful of hospitals are allowing parents to care for their own infants for more than 8 hours a day. The results of one pilot study of 42 newborns show promise. Preemies cared for by parents in NICU gained 25% more weight than babies cared for by nurses, and infection rates dropped to 0 compared to nurses' 11%. Go, mom and dad.